I'm joined by Stacy Plaisance of Intervention Help, who will be sharing some of her professional insight on this topic.
I'm Stacy Plaisance from Seattle, Washington, own Intervention Help. I'm a person in long-term recovery, been in recovery myself for 21 years from substances, and I've been in treatment multiple times myself. Also have a pretty significant family history of mental health and substance use. So for me, doing this work is personally important, but also, really was able to realize through my own journey individualized needs of clients and families, and the concierge work that I do now really is something that I feel like was lacking in the field when I first started. So I started in the field of substance use back in 2004. I started as a tech in a residential program and then moved into my internship and got my substance use credential. I worked as a primary counselor in a program for about 12 years. And with that work, worked in adolescent, women's groups, men's groups, relapse prevention with Terrence Gorski, and then moved into family programming and counseling. With all of that work and seeing all the intricate growth and opportunity that families and individuals got, really realized that I wanted to expand the work that I was doing and reach a larger crowd. My passion really was in the brain chemistry and the genetics of alcoholism and substance use and how that affects generational families with trauma. So I went back to school, got my bachelor's in marketing and my MBA in healthcare management, and then moved over to Seattle from Eastern Washington. So the whole time I've been in the field, I've been in Washington. And when I moved over to Seattle, I was able to have the opportunity to open an outpatient and sober living. Did that work for a number of years. And then, as we all did, faced some challenges in 2020. And there was a huge need in the field for much more private work with families. So started working with an interventionist, and we really did some deep work with families, individuals with mental health, substance use, staying on longer term, doing client placement, doing concierge work where we just, focused on outcomes and long-term outcomes, and doing family coaching, case management, client care, coordination, and intervention work. We adapted that work from Johnson model or surprise intervention to invitational model. And with all of that, I feel like the work that I've done throughout my whole career, I just really focus on the person-centered work, engaging the client, and focus on respect and dignity whenever working with families and clients. So that's what I've been doing now, and moving up to 2024, just kind of growing my business. With Intervention Help, we do a lot of family coaching, client care management or case management, and transportation along with intervention.
So what made you switch the model of intervention format that you utilize now?
The big push was really for me feeling like rapport and authenticity and transparency are the core foundation for me, integrity. And I felt like as a person in recovery, how would I have reacted to somebody, my family, approaching me on some of these really sensitive issues. And we felt like giving them a little bit of warning and giving them some prep time and being able to collect their thoughts, their feelings, and come forth with some solution on their own of what they wanted to bring to the table in a conversation with their family about some pretty sensitive information and lifelong changes and commitments. And so, we decided to give the person of concern 24 to 48 hours notice so that they could really understand that the conversation we were having was different than the conversations they'd had in the past, and that we really wanted to hear their story and their insight into what kind of solutions they were looking for. And so during the process, we come with some solutions and some ideas of the treatment plan or options that we'd like to see in the recovery decisions. And then we're able to listen to them and be a little bit more nimble in the process and negotiate what our goals are for them and what their goals are. And we just have had like a 98% success in getting them to engage with us And that means like whether they choose to engage that day or they take a day or two and think about it and we adjust the plan and they move forward. But, with that, our team doesn't have to backpedal and build that trust because they've already felt betrayed by us, but they already understand that we're different from other models and that we really want to hear them and that this is their life story. So they get to make some autonomous decisions in that.